How are you?
I'm good. How are you all the way in Florida?
I am doing well. We're kind of in a very crazy, unusual time right now, but
I know. Well,
I,
first of all, are you in pajamas?
I'm almost in my pajamas. I was like, I think I can hold out for like about 20 minutes.
Perfect. I'm so glad you stopped by. So tell me how it's going in Florida, because in California we're hearing like everything's shut down except people are still running around the beaches and going on vacation. So what's going on there? How are you and your patients?
Yeah, so it's been interesting because every day things are changing, of course, kind of like everywhere. But we are seeing a lot of people that aren't taking this seriously. And a lot of that is because it's spring break time and everyone has had all their Florida trips planned for months. And now everyone's kind of stuck here and they don't want to make any changes. They want to enjoy their time. And it's difficult to see because then that translates into just our normal like residents here too, because they say, well, the beaches are open and everyone, I think it was around last week that the restaurants started to go to just takeout and delivery only, and schools started getting shut down. And so everyone went to the beach. And we're talking about like people are like body to body on the beach. So
Wow.
it's scary to see that because that's how we know that when we're in these situations that things just escalate really quickly. So, on an individual level, we have such a great responsibility to stay home and try to protect other people. And it's hard when we see other people not doing that. So hopefully, I just saw maybe an hour ago that Broward County, which is on the other coast that I am, which is like Fort Lauderdale area, they're starting to put more like the stay-at-home restrictions, which I think that you guys have.
Yeah.
So I'm hopeful that things are going to start kind of closing down a little bit. But what's interesting with that is that last Friday, I believe, I'm trying to get my days straight.
I know we're all confused.
Yeah. So I think it was last Friday, the governor of Florida mandated that all non-emergency healthcare professionals suspend all services for non-emergency practices. So I know a lot of acupuncturists were starting to get upset thinking, oh, well, we are essential healthcare practitioners. But in Florida, that's not what they were saying. Like, they're not trying to exclude us as acupuncturists. They're saying all PAs, everyone's, we're all kind of like stopped. So that's what's interesting, is that the healthcare services have stopped to hopefully help the emergency rooms and the hospitals stay afloat. But then everyone else is still going out and about and doing their own thing.
So it's like close down your practice, but then head to the beach.
I know, it's a little tricky. So I've been trying to just really empower my patients to stay home, make the right decisions as individuals. And sometimes it's hard to see because right now, I mean, the cases are just really starting to ramp up. So not all of us have seen like that personal impact. And unfortunately, we probably will. And I think until that happens, a lot of people aren't going to be taking it seriously, which is unfortunate because we don't want it to get to that point.
Yeah, that is unfortunate. But I mean, I know we were talking about how, it's difficult when you have patients who are used to seeing you and are accustomed to seeing you, because it is kind of different in every state. So here, they didn't suspend non-emergency, they suspended non-essential. So since we're still considered essential, we're open, but you're right, it is different when they're saying all non-emergency in Florida. So, you're like, okay, I'm closing my doors, but what about patients who are seeing you for chronic pain, for stress, for anxiety? These are things we're seeing beyond immune health that are really popping up. So what creative options are you finding to stay connected to your patients right now?
Yeah, absolutely. I mean, that's so important because the first thing that we think of is that it's not just, okay, yes, as an individual, like I want to make sure I'm safe, my family's safe, but we also have this larger responsibility to our patients. Mm-hmm. And I'm really lucky that my patients come to me pretty much every week. Like I see everyone very regularly. Yeah. And these chronic health issues don't just magically go away when we're in the midst of a viral outbreak. And a lot of times these things get worse. I treat a lot of patients with stress and anxiety and depression, and these things can almost just get heightened during this time. So that doesn't mean we can't stop care. And we're so lucky, because I was thinking of other, even just healthcare professionals that don't have as many tools as we do. We're actually extremely lucky that, yes, we're called acupuncturists by most people, but we have this wide range of different tools and modalities that we can use. So that's something that we can do. So bringing in, be able to do virtual consults for herbal medicine, which we know is very powerful, and that's one of the main things we normally use. But even going into, how about let's do some like Qigong, or do some Tai Chi, doing just nutritional counseling, diet counseling, and also just creating that space and still being there for our patients. Because I think that if we take a step back and we look at in our practices, like, what are we actually doing for our patients? Yes, most of the time I love needling. That's my main tool that I use. And so, yes, I end up needling my patients. But for about a half hour before I even touch the patients with needles, we're talking, we're figuring out how was your week? What's going on? So much of what we do is beyond actually just putting acupuncture needles in. So that's something that we have to just remember, is we have all these tools to treat our patients. And even though if acupuncture is your main treatment modality in your practice, that doesn't mean you can't tap in to those resources, because we have that. We learn these other modalities in school.
Yeah. I mean, you and I went to school together. So that's beyond our undergrad. That's for a master's program. And then, a lot of us end up doing the doctorate as well. So 4 years in a master's program devoted to all of these incredible techniques that are available to us. And yes, we had thousands of hours of experience when it comes to needling, but yes, we absolutely focused on nutrition. We definitely focused on herbs and how to make that work. And we were always told the treatment starts happening as soon as the person walks in the door. It's not when the first needle goes in. There is a physiological response that starts there when the first needle happens, but that entire experience is part of helping someone get better. And everyone's needs are a little bit different with that. I have my athletes who come in and they're dealing with something that's, post-op, and okay, there's not as much talking involved in that. We're very clear, what's the protocol here? Where are we at in your post-op experience? How are we going to help you heal? But for some people who, need to talk about their stress, that might be the only hour of their entire day that they're not around their kids and other people who need things from them. That might be the only hour of their day that's 100% about them. And you can still create that experience virtually. You can still create that experience without physically putting your hands on someone and needling them. And you're right, this is a huge area of opportunity where we can think, oh, wow, let's tap back into all of these other tools that we learned in school, even if, acupuncture is our main mode of treating in practice, which it is for me too. It's incredible to think about, well, what about all the other things that we spent so many years learning and practiced so much and learned, and we do implement, and now that can be the primary thing that we really get to implement.
Yeah, absolutely. And it's interesting because I think what's grounded me the past few days is getting back to what do we do as traditional Chinese medicine practitioners, or, Eastern medicine practitioners, because it really comes back to the foundation that we learn. So we're talking about, at a very basic level, creating balance in the body. That's what we're doing. So then we have these tools to use it or to be able to do that. And what's really special about Chinese medicine is that it's so individualized. And all of our treatments, even acupuncture treatments, okay, maybe you have protocols that you might use for similar cases, but the basis of everything that we do is we're treating individuals and we're meeting them with their needs. And what's interesting too is, so I also treat pediatrics. My pediatric patients don't let me needle them. I mean, some of them do, But, you know, even so, we have to be creative and we have to be able to, you know, be flexible. And Chinese medicine is very adaptive like that because, okay, let's say even with, if we're talking about needling, we have so many points to use. So certain patients, like if you know you can't have them face down, then okay, you do a face up treatment or the opposite, or if you have to have people laying on their side. So when we think about what we actually do, we can do this because we do it on a daily basis. We just have to shift our mindset into like maybe focusing a little bit more on the herbs and figuring out other ways that we can support our patients because they really need us right now. And even though we're getting, you know, different mandates between different states of what we can and cannot do, you know, that's also very important. That's in part of their individual health because you know, if our practices are booming business as usual right now, then we're potentially exposing our patients. Yeah. And so it's always, I don't think, even though so much has changed, the basis, I think, of what we're doing hasn't changed. We're putting our patients first. We're being creative and using the thousands of years of experience of all of the practitioners that came before us. And if we think of all that time, they've had to adapt through so many different scenarios. And we're so lucky to have the technology, like we can do this.
Yeah, absolutely. And, you know, that customized availability of Chinese medicine is what makes it so exciting. And for us to also be given the gift of the extra time, because even those of us who are still open, like you said, we're not treating in the same capacity. I'm not, you know, bringing on new cosmetic patients at this point. It is about who needs to be treated right now and how can we be, you know, the most effective we can possibly be. But coming up with those like kind of really creative, personalized ideas, okay, what all can I do here? Like a colleague of mine has been doing remote acupressure sessions, which, yeah, you know, it's not acupuncture, but there's absolutely a benefit to it, especially if you're having a practitioner who works with you on a regular basis, who knows your body, who has a relationship with you, sit there and guide you through, okay, like this is how we're going to do this. This is why we're doing these points. I have another colleague who's like doing, I have ear seeds here, who's doing ear seeds for patients. Yeah. So like she's doing these remote consults with people and then talking them through everything, doing acupressure, and then explaining to them where to put it on the ear. Like she has a little ear model, she sticks and she's like, okay, this is what we're doing. So there are ways to absolutely personalize that approach, even if you cannot physically be in front of that person. And what does this individual need? I spent a long time in school. I'm just the guide. You're the hero of your own story. How can I best help you in this moment, even if you can't physically come into my practice?
Yeah, I mean, because the thing is, we're working in like non-ideal circumstances right now, like right. A lot of healthcare practitioners. And so, yes, of course, we rather our patients come in and be able to, you know, needle them and give them and really be able to feel their pulses. That's something that's kind of been a struggle for me because I really rely on the pulse diagnosis so much in my practice. So now I'm like doing videos and I'm like, let me see your tongue, you know, and I'm starting to rely a little bit more on that. And it's a really beautiful thing that we can do this right now and that we have these techniques that we can use. And yes, we have to do things that maybe we wouldn't normally tell patients to do, you know, putting in their own ear seeds, but hey, this is the best they got that we can do right now. And if we know that that can help them, maybe the point's a little bit off and it might not be as therapeutic as if we put it on, it's still helping them and it's giving them like control over their health in this very like unusual time that we feel that we don't have a lot of control.
Yeah, see, I'm a big tongue diagnosis person, so I'm loving this remote consult right now because I love looking at the tongue. I like it even better than pulse. I almost get so caught up in the pulse. The tongue looks so much more objective to me, and I think particularly for herb diagnosis, the tongue is amazing as a diagnostic tool. So to be able to get on a remote consult with someone, speak about their individual needs, and again, like we said, stress is so heightened right now for people. There's still people that are pregnant and need to, take care of their health in that way, who are even more concerned about, things, or people who have young kids at home. So there's all different concerns based on your individual situation, what you could potentially be exposed to. If you're looking for, hey, I'm healthy, I just want an extra immune boost, that's fine. But so many exciting ways that we can help people right now. And I think the extra gift of time that we have as well is such a cool opportunity to dive into the books again. And people are trying to stash all of the immune herbs and buy all of them off the shelf, but it's a very cool time. Yeah, it's a very cool time to customize that.
Absolutely. And that's the thing too, is that, sometimes we get caught up of, okay, everyone needs to be on Jade Windscreen, which is kind of the first go-to immune booster that we think of. And okay, great. That's a great formula. And it works for a lot of different people because it's only 3 herbs. It's really safe. But right now it is a little tricky to get that. But we have so many different herbs that we can use, and the basis of what we're doing is we're still treating the individual. Like, even if you're saying, oh, I want to support my immune system, or I want to sleep better, we still need to know more information. Like, we're looking at you as a person. And that's, I think, what's really important to remind our patients, is that we're not just giving you like a one-off, just medication or supplement that everyone's taking. Everyone needs to take this right now. It's like, no, like, what do you need to take? There's certain things that might be standard, but we can customize that, and that'll fit their needs better, and then keep them even healthier in the long run, because we're actually treating their specific pattern diagnosis, which is really amazing.
Right. And like you said earlier, it's like different in every state what we can do. Federal guidelines have gotten a little relaxed with telemedicine now, because they realize that everyone's, shifting that direction as much as they can right now. So it's kind of an exciting time too for that, to look at these new technologies, to not just look at the new areas of Chinese medicine that we might not have been fully diving into or using with every single patient, but it's also like, okay, well, how can we expand our scope? How can we, get a little more creative? And it's going to always be different in every state, whether there's, this pandemic going on or not. Like, you're in Florida, I'm in LA, so you guys can do point injection therapy, right?
Yeah.
Which is so cool and so amazing. I want to inject Chinese herbs into acupuncture points and get people amazing results. But even that's different state to state. So there's always going to be differences. And we just have to worry about, all right, well, let's customize this, make it within what we can do, and do the best that we can for our patients, whether it's in a situation like this or whether I physically have my hands on that person.
Yeah, and I think what you mentioned about like the different states is something really powerful to think about, because that's the importance of like staying connected and having these types of conversations, because I may be doing things that's in my scope that might end up being in your scope that you don't even know yet, or kind of the opposite. Like, if we're kind of working with different parameters, but that might open doors for each other of different like treatment options. And of course, everyone needs to stay in their scope of practice. Right. But if I'm saying like, hey, Dr. Nell, I'm starting to use this with my patients, like, see if that's something that you can try.
Absolutely. So I hadn't thought about the ear seed idea until I talked to a colleague of mine. Like, I was like, because I think we also too, because we did spend so much time in school and we do spend so much time with our hands-on patients, we're like, oh, well, it's not going to be the same as if I'm, doing the ear seed or I'm needling the ear, but it can be still incredibly powerful. It's still 10 times better than if they did nothing. So there's a lot of value that we can add, even though it's different. It can still be so beneficial.
Yeah, absolutely. And even you're talking about the acupressure. I did a consult stay with one of my patients, and afterwards I wrote like a 3-page document of like acupressure protocols. Because you also my patients, I miss seeing them also like on an individual level, because I see them all the time. I'm so invested in their health. I'm like, I got to give this person everything I got. And so I think that's what we bring as practitioners too. And I know your patients feel the same way. It's like, we're here, like we're 100% here for you. And even though we're still trying to figure out like how we can bring our treatments to you. We have so many options, and we're really trying to, pull this all together so we can give our patients like all the support that they need right now.
Exactly. And if we have all these ideas now, give us a few more days and we'll keep coming up with more ways to help everyone. So I think, do you have any last words, Molly? I think this has been such a fun talk, and I'll make sure to save this. I want you to enter your Instagram handle in the chat box so that it's saved as well. Hi, Phil. Phil is saying hi. Yeah, just do it as a comment.
I can do this.
So yeah, acupuncture is connecting from all over. I love it.
I love it.
But yeah, before we close, I just want to know if you have any last words. I feel like this was one of my favorite chats yet. I love the customized approach of Chinese medicine, so it makes me really happy that we're connecting across country.
No, it's really special, and I thank you so much for reaching out to me to do this because, we're all in this together, and all the other acupuncturists that see this, like, let's just talk and let's figure out how we can come up with ways to support our patients. And even if we have to do it together and like share resources so we're all not writing 3-page acupressure documents like I did today, like maybe that's something we need to do too, is like to create resources for each other. So it's like, hey, I have this document on techniques for stress reduction or some breathing techniques that I have already written out. Maybe we need to do that and just share our resources so we can get things to our patients quicker. So maybe we could do something like that. But I'm here, I'm so excited to be in this time, even though it's very like scary and confusing and challenging. There's a lot that we can do, and we can still bring value to our patients and also the other medical professionals. Like, they need our support right now too. So we have a lot of tools to help people. Yes.
Well, we might want to do another one of these in a month as things continue to transform. But thank you so much for coming on, and I'll be sure to save this. So this video will be up if you guys just tuned in at the very end. But Molly, thank you so much. It was great to see you from across the country, and we will talk soon.
Thank you so much.
Bye.
Bye.